Good Tuesday afternoon. I'm Dr. Martha Buchanan, Director and Health Officer here at the Knox County Health Department. My moment of gratitude today is for our team. For the past 7 months, they have worked tirelessly to address and reduce the impact of COVID on our community. It has been a long and difficult 7 months. I know everyone can relate to that. In this crisis, in a crisis as long as this, and as impactful as this one, it's important that we all take time to look for the good. Celebrate our accomplishments. I sent our team a letter yesterday highlighting the great work they have done, and I'd like to take a moment to share some of those things with you right now. Since March, our team has collected over 20,000 specimens for COVID testing. We've investigated 11,022 cases, traced 24,855 contacts. Our emergency preparedness team has coordinated response and provided logistical support to more than 250 healthcare organizations throughout the region. We stood up a phone bank, which has handled more than 43,000 calls since March. Our team has created more than 60 COVID-19 educational videos in 5 different languages. Even though we've mounted a massive local response that I'm very proud of, we are still managing to provide other much needed public health services, such as family planning, WIC, restaurant inspections, dental, communicable disease testing and treatment services, among many others. Our WIC participation is higher than it's ever been. These are a few examples, as a full list would include too many to name. I believe our team is doing a great job looking out for the health and safety of our community, and I'm proud to work alongside these incredible people every day. We are continuing to test for COVID at the main health department location at 140 Dameron Avenue. Testing will happen Monday through Friday, 9 a.m. to 3 p.m. We are also having another public flu clinic today at Christenberry Elementary from 3 to 6 p.m. Anyone 6 months of age or older can come and get their flu vaccine. We will have both the flu mist and the flu shot available. We will not have high-dose flu vaccine at this clinic. Please come and get your flu vaccine. This year more than ever, it's very important that we all get vaccinated for the flu. Now I'll move to the local situation. We have 146 new confirmed cases since yesterday's report, giving us 11,170 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 513 probable cases. 10,317 of our cases are considered inactive, giving us 1,277 active cases. 396 individuals have been hospitalized at some point in their illness. Currently, there are 70 Knox County Knox County citizens hospitalized. Unfortunately, we have 3 additional deaths to report today, raising our total to 89. I'll now open it up for questions.
All right, first question we have is from David with WVLT. How should people go about voting if they plan to vote in person? And what recommendations did the health department give to the election commission for safety for poll workers?
You're going to be really surprised by this answer. The 5 core actions. That's what we recommended to the election commission, that people practice social distancing or physical distancing, wear a face mask. And just a reminder, a face shield is not a substitute for a cloth face covering. Cleaning frequently touched surfaces regularly. Not going to the polls to vote if you're sick or if you've been told to isolate or quarantine. And washing your hands regularly. How can I forget that? So those are the things that were recommended. The Election Commission is following guidance from other entities as well, due to their special. We made recommendations for face mask wearing. There are jurisdictional limitations on where things can be required.
From Jeff with WATE, hospitalizations keep going up to record levels. Last week, KCHD suggested a higher level of viral activity than testing numbers suggest. Is this still the case?
Absolutely. We and our hospital partners are very concerned about the rising number of hospitalizations. What that tells us is that the disease burden in our community is higher than testing would indicate. Why is that so? We believe it's so because people are avoiding getting tested for a multitude of reasons, either access to testing, they don't want to isolate, they don't want to quarantine, they don't want to have to tell their friends to quarantine. None of those are any fun, but the challenge is if people don't get tested and they don't know they have the disease and they don't stay home, they're just going to keep making other people sick. And that's our big concern. And we're just going to see those hospitalizations go up and as a result, see our deaths go up.
Also from Jeff with WATE, can you gauge how much larger the actual viral presence is compared to what other metrics show?
I can't. That's a great question. Can we look at our death, our hospitalizations, and somehow extrapolate that to tell us what our disease burden is in the community? And I'm not sure we can do that, but it's a reasonable question. What we do know, though, is that we know hospitalizations are going up, and the reason those are such a true indicator is that if you get COVID and you get sick enough to go to the hospital, you're going to go to the hospital. You're not going to stay home and go, oh, I don't want to go. You may not want to go to the hospital, but you're going to end up in the hospital, unfortunately. And so this underlying, level of disease in our community, which is putting other people at risk, is the thing that we're most concerned about.
From Monica with the Sentinel, the number of hospitalizations has been increasing recently. At what point should hospitals start to worry about their surge capacity? And do you have any concerns about capacity right now?
Hospitals meet regularly, and that's a great question for the hospitals. They know much more about their surge capacity than we do.
From Daniel with WBIR, you spoke to voters practicing 5 core actions. Would you go as far to say voting in person is safe?
I think if everybody practices 5 core actions, sure, it's safe.
From David with WVLT, has the death rate changed in the area with more treatments coming online?
Yeah, I think that's a great question for our hospital partners. And so they know more about the treatments coming online and what they're using them for and how they're using them and how it impacts outcomes. We don't really have that data.
From Daniel with WBIR, poll workers tend to be older and therefore more vulnerable to health threats. How has KCHD collaborated with the Election Commission on safety guidelines?
We've advised them on the safety guidelines they need to put in place and answered their questions. And again, it's really emphasizing why it's very important when you go to vote, practice the 5 core actions to protect yourself and those folks who are volunteering their time to allow us to exercise our really great privilege of voting in this country.
From Jeff with WATE, do you know yet how long you'll continue the after-school flu clinic events?
We have a few more planned, and I don't think I have a definite answer to that. But
yeah, Jeff, we've got a couple more planned, and we'll be releasing information on those locations in the coming days. From Daniel with WBIR, as voting begins, do you anticipate a corresponding spike in cases similar to increased activity with the start of schools?
I think it's really important. Voting in schools are very different. Schools, you go there all day long. You're together with mostly the same people all day long. Voting is a limited time experience. It doesn't take a whole day to vote. So hopefully, if everybody is really diligent in practicing the 5 core actions when they go to vote, we won't see a spike in cases. If they aren't, we might see a spike in cases.
All right, any other questions? Please go ahead and submit them now. From Jeff with WATE, we see seasonal allergies and wintertime colds this time of year. How do those symptoms differ from COVID-19?
It's a great question for practicing physicians, for one thing, since we don't actually see patients here and diagnose COVID-19 here, we just do testing. But the symptoms start out very similar. With COVID-19, you're going to get a fever. It's going to last longer than a cold. So you usually don't have a fever with allergy symptoms, but you're going to feel achy and get a fever, and it's going to last longer. Generally, the symptoms are more severe than either seasonal cold or seasonal allergies.
From David with WVLT, do you have concerns about a spike in cases as families and staff come back from fall break?
We'll just have to wait and see how that happens. We're hoping that when everybody was gone for fall break, they practiced the 5 core actions, even though they were out of town and on vacation, because COVID doesn't take a vacation and COVID could be caught anywhere in the world right now.
From Monica with the Sentinel, tomorrow the Board of Health could vote to extend the 11 p.m. bar closure order. What data points will you consider before voting or making your recommendation? And go ahead. questions.
Okay. We'll be looking at our benchmark data like we always do, and looking at the data from Dr. Shamia, where he brings information from the hospitals. We'll be considering the same large data points we've looked at before, and also what's going on across the country and information from other communities that we are aware of. We'll consider all of that information.
Her follow-up question was, have you continued to see success in combating COVID-19 with that order?
You know, it's really hard to say what directly impacts our COVID-19 numbers. Right now, we're seeing COVID-19 numbers go up, so we're concerned about that. We've seen our hospitalizations go up. We're concerned about that as well. You know, it's proving cause and effect when you put things in place it can be challenging because there are other things you have to think about. What we know is after we put the mask mandate in place, we did see our numbers stabilize. Then some things changed. So I think we'll just have to continue to look at the numbers. It's not just one data point, and there's, you know, success would be to see our numbers going down, which they had been trending down until recently. So, you know, we're not sure what's impacted that. We'll have to continue to look at that data. You know, reporting data out like we are now real time is so unusual for public health and really unheard of. We normally take time to look at it and try to see cause and effect. You know, what happened that caused these numbers to go up. We're not able to do that because we're giving you real-time data right now. So stay tuned. We'll probably have more information, not like next week, but in several months, we're able to really analyze the data.
From Jeff with WATE, did UT's Neyland Stadium distancing measures work? Are there any cases connected to the game and any new suggestions for the upcoming game?
You know, I'm not familiar with the distancing measures that they put in place. I think once upon a time I probably did look at them or get asked about them. You know, we don't go that far back with COVID history taking. So the exposure would have had to happen in that time frame. I'm not aware of any clusters related to attending football games or other activities related to football.
Any other questions? Please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time, and we will see you again on Thursday at 12:30. Have a good rest of your day.